Hello everyone, this is Dr. TSR. Today I am here to share you the guidelines regarding medical management, expectant management of ectopic and as well as the adverse effects and contraindications for methotrexate. So this is Dr. TSR. Kindly do subscribe to my channel for more such videos and like, share and subscribe. Okay, so in the previous video I already told how to manage ectopic pregnancy through medical management, that is single dose or double dose or multi-dose regime, that is already explained, right? So what are this ectopic pregnancy? It has two categories. One is medical management, another is expectant management. So expectant management when I do is when the ectopic size of the ectopic is less than 30 mm and there is no evidence of fetal cardiac activity, there is no evidence of rupture, there is no hemoperitoneum, the patient is stable and moreover she is ready to follow up. So and the patient is having declining level of beta HCG. So here comes the thing, the level of beta HCG is inversely proportional to the success rate, or the success is inversely proportional to the level of beta HCG. So that is the thing that you should know. That means if the beta HCG is less than 175, so the success rate of expectant management is 96%. If the beta HCG is between 175 to 1500, the success rate is only 60%. So this is about expectant management. Coming to the medical management, the good candidates are, the first thing is the patient should be hemodynamically stable. Second thing is beta HCG should be less than 5000. Okay, and there should not be cardiac activity and there should not be any intrauterine pregnancy, and the next thing is the size of the sac should be less than 3.5 cm or less than 35 mm. Then within this there should be no cardiac activity, and the next most important thing is patient should be willing to follow up. Okay, if these criteria are met, then only I will consider giving her methotrexate, that is 50 mg per meter square 1 ampere, or you will give us 0.1 mg per kg, that is a multi-dose regimen, right? So when you are giving methotrexate, you should tell the patient not to drink alcohol and you should avoid the foods which is containing the folate. So folate containing food we have to avoid because our methotrexate is anti-folate drugs. So what are the adverse effects? ADR because of methotrexate is, first thing is bone marrow suppression. So the second, bone marrow suppression. Okay, then the second most important thing is pulmonary fibrosis. Bone marrow suppression, pulmonary fibrosis, non-specific pneumonitis, then comes liver cirrhosis, then comes liver cirrhosis, then it affect even the renal failure because methotrexate is excreted through kidneys, renal failures. Then the most important is gastric ulceration, so there will be mucosal ulceration and even the stomatitis. So these are some of the adverse effects of methotrexate. So if the contraindication or if the patient is hemodynamically unstable, there is intrauterine pregnancy and she is breastfeeding, she is unable to follow up, or she is having liver diseases, or because bone marrow suppression, blood risk rhesus, or any pulmonary active pulmonary disease, tuberculosis patient with ectopic and immunodeficient HIV patient with ectopic, then you have to think before giving methotrexate. Okay, the main thing is bone marrow suppression, pulmonary fibrosis. So whenever you give methotrexate, before giving methotrexate, you have to get complete CBC count, RFT count and LFT count. What it usually happens na, in busy schedule we will check the CBC. If her HB is good, she is we think there is no intraperitoneal hemorrhage is going on there, so the HB is good, she is good candidate for giving methotrexate, and we won't even look after RFT, LFT in a busy and hectic schedule. So that thing usually happens and happened also. So you should check RFT and LFT, renal function test and liver function test has to be checked before giving methotrexate. This is about the medical and the expectant management of methotrexate and the adverse effects related to methotrexate and the most important investigation which you should do before giving methotrexate. So this is Dr. TSR. Thank you so much.